Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Let me start by reading some quotes with regards to safe supply and the diversion into criminals' hands. March 12th of 2024, the government House Leader said that widespread diversion was, quote, simply not true. February of this year, Mr. Speaker, the Premier questioned this, saying, quote, if it is happening. February of 2024, the Provincial Health Officer said, quote, diversion is not in itself good or bad, or right or wrong, end quote. The government's own leaked report has shown that this information, that these statements are false. Will the Premier stop gaslighting the public? Will he admit his government has been misleading the public on this? And will he enact a public inquiry into the safe supply scandal?
Honourable Premier.
We've lost 16,000 people in this province to the toxic drug crisis since it was declared. It's fathers and mothers and sisters and brothers, colleagues, friends. And the consistent message that has come to us from people who've lost loved ones is do whatever you can to try to help keep people alive, get them into treatment so they can rebuild their lives. And it's advice from family and friends like that that resulted in the prescribed alternative program to get a nurse or a doctor between someone struggling with addiction and a predatory drug dealer. We know it saved lives. We know it stabilized lives. The Conservatives know that too. And their spokesperson has supported the program in principle. But that doesn't mean that we tolerate diversion. We have taken steps with police. This is how the opposition knows about the issue with these pharmacies, to investigate bad pharmacies, to ensure that that information is shared with police for prosecutions, to address issues of diversion. Now the Health Minister has made an important but difficult announcement to move to an exclusively witnessed program, which we know is going to make it harder for some people to access this program that we know could save lives, but which we have to do to address the issue of diversion.
Leader of the Official Opposition, supplemental.
Mr. Speaker, it's true that 16,328 people have lost their lives to overdose. That's true. But it's also true that the Safe Supply program has put 22,416,000 doses into British Columbia and an unknown number of those into the hands of criminal activity. The report by this government shows that that is the facts. These drugs, of course, are also not safe. They are actually very dangerous drugs as well. The report clearly shows that this has been going on for years. The police reports have shown that this diverted supply into the hands of criminals has been going on for years, and yet, as given those quotes, this has been denied by this government. The real question that the public is asking is who knew in advance how bad this situation was? When did they know about it? And quite frankly, the taxpayers want to know how much their money was wasted on drugs getting into criminals' hands. This is why, Mr. Speaker, the Premier must call a public inquiry and get answers to the public that demand to know how this government has been mistreating this file.
Premier.
Honourable Speaker, the risk of pharmacies diverting opioids existed before the prescribed alternative program. It exists after. The entity within the Ministry of Health that was set up.
Members, Premier has the floor.
The entity within the Ministry of Health that was set up to investigate pharmacies was set up in 2014 by the BC Liberal government because of issues related to the diversion of opioids. And so ensuring that that agency had the authority, was focusing on pharmacies and the issue and the risk of diversion was a priority for us. We ensured that they had the resources to do that. It resulted in a very significant investigation, which they were briefing police on. That's how the opposition knows about this. It has resulted in criminal investigations that are ongoing. with the College of Pharmacy to shut down bad actors, and the unfortunate and difficult but necessary decision to move to a witnessed-only program, which we know will compromise the access of people who need this program to stay alive, but we have to do to ensure that we're addressing the risk of diversion.
Member for Surrey Cloverdale.
Mr. Speaker, the Premier and his government want you to believe that this is a problem with bad pharmacies, that it's bad actors. But this isn't a problem with bad pharmacies. This is a problem with bad policy, and the bad actors are members of this government and bureaucrats working under the supervision of this Premier who have been gaslighting British Columbians for more than 2 years. Mr. Speaker, after years of downplaying and denying the significant diversion of so-called safe supply, the government's own leaked presentation reports that their publicly funded drug trafficking is widespread. Taxpayer-funded safe supply went from prescribing 577,000 pills in 2020 to more than 22 million pills and fentanyl patches in the last 2 years. Wow. This is increasing the risk of population-level harms, with unknown quantities, Mr. Speaker, being trafficked provincially, nationally, and internationally. The public has a right to know, how could this happen? Now that the Premier recognizes his experiment has failed, when will he call a public inquiry?
Mr. Premier.
Thank you, Honourable Speaker. I think it's important to be clear. I canvassed this with the member for Surrey Cloverdale extensively in the estimates debates before the election. I acknowledge the risk of diversion is a serious issue. We were taking steps to ensure diversion, if it was taking place, was being addressed, resulted in dedicating a team within the Ministry of Health to investigate pharmacies, which is what the opposition has become aware of. It's led to criminal investigations. It is a serious matter. But on the issue of prescribed alternatives, I won't let the member shrink from her own record, because it's important to recognize that there's not a division in this House about the need for this program. February 17th on CKNW, the member said, "Conservatives, we know that there's a role for these drugs to be used to help people, to be titrated to other medications, to stabilize people." Well, I agree entirely. The unfortunate thing is some people are going to lose access to this program because of a difficult decision to move to witnessed ingestion only. And that's an unfortunate thing, but it's a necessary thing to address the issue of diversion.
Surrey Cloverdale, supplemental.
Mr. Speaker, more gaslighting from a Premier who fails to recognize his own failed experiment. For sure, there is a role for prescribed alternatives for drugs to help titrate and stabilize, but we're talking about a government program that has dumped millions of pills into the hands of criminals and drug traffickers, and I first raised the issue of diversion in this chamber on February 9th, 2023. That's more than 2 years ago. 2 years of flooding this province with hydromorphone, a highly addictive opioid 5 times more powerful than morphine. 2 years of fueling the fentanyl trade with program participants trading their dillies for street drugs. 2 years of taxpayer dollars being used to enrich criminal organizations, putting money into the hands of drug dealers that have killed 49,000 Canadians. Mr. Speaker, British Columbians have the right to know, how did this happen? When will the Premier call for a public inquiry?
Premier.
I'm sure the member didn't do it intentionally, Honourable Speaker, but she conflated the toxic street drugs like fentanyl and carfentanil with the prescribed alternative program supervised by nurses and doctors. We've lost more than 16,000 people to the toxic drug crisis, and the prescribed alternative program, what I understood the member previously supported when she said the government has introduced a safe supply where they're giving hydromorphone and other drugs, slow-release morphine, they give it to individuals to help them get off illicit drugs. and that we need to continue exploring. Or when she said, this government was said to be exploring options for pharmaceutical alternatives to illicit drugs, and that's what they should be doing. That's October 26th, 2023. As recently as February, supported the program. It's an important program to save lives, but that doesn't mean that we tolerate.
Premier will continue.
Doesn't mean that we tolerate diversion. And to prevent diversion, we have to take the unfortunate but necessary step of moving to a witness-only.
Members. Premier.
Moving to a witness-only program, which will restrict access to the program for some people who are struggling with addiction, especially in rural areas. But we have to take that step in order to ensure that the public is protected. And we'll continue to support the ongoing police investigation, the college investigation into these pharmacies as best we can.
Leader of the third party.
Honourable Speaker, British Columbians are feeling alarmed and anxious, and with good reason. According to Finance Ministry estimates, U.S. tariffs could lead to 124,000 job losses in BC over the next 3 years. The government's main response to the tariff threat is a hasty plan to fast-track 18 mining and energy projects, including an LNG export terminal. The government estimates these projects would create 8,000 jobs. That leaves 116,000 job losses unaccounted for, a staggering number of jobs. Grocery rebate or not, British Columbians are left wondering how this government will support them during this time of uncertainty and how they will fortify our economy so we're less vulnerable to forces beyond our control. My question, Honourable Speaker, is for the Premier. What is the government's plan to protect people's livelihoods in the short term, but also transform our economy to deliver clean prosperity far into the future?
Minister of Finance.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. Thank you to the member opposite for the question, and welcome to this House. One of the first tasks I was charged with in becoming Finance Minister was to bring forward the grocery rebate. We know that there are people in British Columbia who are struggling with affordability. We've taken many measures to support people in affordability. But, Mr. Speaker, on November 25th, when then-elect President Trump announced 25% tariffs across the board to Canadian businesses, the world changed. And we cannot move forward with the grocery rebate. We will, however, continue to support British Columbians in so many ways. And we will double down on the most important things for British Columbians: healthcare, education, safe streets, and ensuring that social services are available, Mr. Speaker. We are moving forward with growing our economy, and we're doing it in many, many ways. And while we accelerate these important projects that we have brought forward, acceleration doesn't necessarily mean only getting to yes. Acceleration can also mean getting to no, because we're still keeping the vital, vital protection of environment and collaboration with Indigenous peoples as our guiding light on these decisions. What we're getting rid of, Mr. Speaker, is death by maybe.
Thank you. Leader of third party supplemental.
Thank you. The Premier suggested in January at a mineral exploration conference that this government's, quote, hyper-focusing on things like Indigenous reconciliation, end quote, had pulled attention from economic growth. Economic growth from resource extraction can't happen without Indigenous consultation. It's the law. While I recognize that 12 of 18 projects have Indigenous partnership, on February 7th, the Tahltan Nation released a statement saying it was, quote, frustrated and surprised by the province's announcement of projects to be fast-tracked, 2 of them in Tahltan territory. On environmental assessment, the BC Oil and Gas Commission was frequently criticized for being too friendly to industry, and a name change alone will not fix that. How can British Columbians be assured that this government isn't using the tariff threat to push ahead with more conventional resource extraction at the expense of Indigenous rights and critical environmental protections?
Minister of Indigenous Relations and Reconciliation.
Thank you, Honourable Speaker, and thank you for a critically important question. It's an honour to get to speak to the partnerships that this government continues to form with First Nations across the province in economic development, as well as in a whole range of efforts to improve the quality of life for First Nations and Indigenous communities, as well as all British Columbians. The work that's been done to move projects forward in light of the alarming threat of tariffs includes, as folks in this House know, an important economic benefit for First Nations, and in fact a majority ownership by equity ownership by First Nations for a number of those projects. Those partnerships continue to be a priority for this government, and where there are difficult conversations, those are difficult conversations we're showing up to have side by side to figure out how we move forward together in this province. The path to prosperity for British Columbians is in partnership with First Nations, and that's a commitment we'll continue to make.
Thank you. Member for Skeena.
Thank you, Mr. Speaker. While this NDP premier was saying that diversion wasn't happening, his government knew that the police were investigating. Then Minister of Mental Health and Addiction said, quote, "I would say again that I have not heard directly a concern from law enforcement or seen evidence from law enforcement of safe supply being diverted," end quote. To the Premier, through you, Mr. Speaker, will he finally admit that the NDP's safe supply program has failed and it has only fueled BC's drug crisis?
Premier. Premier.
Thank you, Honourable Speaker. We work closely with police throughout this process, including with the RCMP, supporting them with the resources that they need to be able to do these investigations, providing them with information, including a briefing that...
Members, there was no interruption when the question was asked. Let's provide the same courtesy when the answer is provided. Thank
including
you.
a briefing to assist frontline officers. Including a briefing to assist frontline officers in being able to identify diverted drugs. And I think that's one of the reasons why because we have been engaged in this work together, the Association of Chiefs of Police issued a statement today stating that they recognize the importance of harm reduction measures, including safe supply and addressing the ongoing toxic drug crisis, and noting with approval the move by the province to move to witness ingestion, saying, quote, "It is equally essential that these programs are structured in a way that prevents unintended consequences, including the illegal redistribution of prescribed substances." We agree entirely. That's why we've taken the step of moving to witnessed ingestion. It's a challenging decision because we know it'll limit access of some people to the program, but it's a necessary step, and glad to have the support of the police in taking this step.
Member for Skeena supplemental.
Thank you, Mr. Speaker. That really wasn't an answer. 14 years ago, I was a homeless addict living on the downtown east side. And I can tell you that the people that are going to die today and tomorrow deserve better than that answer.
I didn't see any question on that. Thank you very much. Let's move on to member for Prince George Wayalmount.
Thank you, Mr. Speaker. 50 bags of drugs, 700 pills, including fentanyl, methadone, methamphetamines, and cocaine, which according to the Prince George RCMP, a significant portion of which was diverted from safe supply. If the Premier had his way, the RCMP would not have taken these drugs off the streets, as it was his government that put them on the street in the first place. When will this government stop being the dealer for BC's drug addiction crisis?
Mr. Premier.
Oh, Honourable Speaker, that is completely false and regrettable. You know, it was when the Leader of the Opposition was in Cabinet. Drug dealers walked into BC casinos with hockey bags full of money, with impunity, after repeated warnings that was happening. Refused to take action. Now we have unexplained wealth orders.
Member.
Now we have unexplained wealth orders in 4 different cases being used against people who have astonishing wealth with no apparent means of producing it. We seized the Hells Angels clubhouses. Let me tell you, since 2020,
Members come to order.
since 2020, police have seized over 1,800 firearms, 20 million in illegal cash and assets, and over 15,000 kilograms of illicit drugs and precursor chemicals. We've provided witness protection to people coming forward to provide evidence against gangsters. It resulted in 80 different prosecutions of gangsters in this province, successful prosecutions, putting gangsters behind bars. Steps that Leader of the Opposition could have taken when he was on this side of the House. So I urge the member to look into her own leader's history before suggesting that this side of the House has done anything except attack organized crime from day one.
Member, that's enough. Member, Premier, conclude,
From
please.
day one, Honourable Speaker.
Thank you. Prince George Wales, supplemental.
Mr. Speaker, thank you. The Solicitor General and the Premier may remember Sean Wright, the recently retired superintendent from the Prince George RCMP detachment. He said criminalization is, quote, the most horrific failure of public policy, unquote. Sean Wright, PG Citizen, August 14th, 2024. The RCMP know that the NDP's policies are a failure. Does the Minister of Public Safety stand with the RCMP and will support the call for a public inquiry into the safe supply now?
Minister of Health.
Thank you very much. Thank you very much, Honourable Speaker. I think what the public wants most to know is that we are doing everything we can to save people's lives during a time of a toxic drug crisis that has impacted thousands of people. Not one person in this House, I bet, has not been touched by this crisis. And that's why we're taking every tool that we can and using it in a way that is evidence-based and is working to save people's lives, like the Prescribed Alternatives Program. Today, as has already been canvassed and as the Premier has said, difficult decisions were announced around how we can ensure the integrity of this program in a way that keeps people safe, the people who are using prescribed alternatives and the people living out in our communities, keeping people safe together. The public wants to know we're doing everything we can. And Mr. Speaker, that is exactly what we're doing. And we're going to stay focused on that, not just through the Prescribed Alternatives Program and making the changes that we've announced today, but by continuing to build the spectrum of supports that people need. Everything from prevention to treatment and recovery, building out that seamless system of recovery to help people in the best way possible. Thank you.
Member for Courtney Comox.
Mr. Speaker, my question is directed to the Minister of Health. Don Chamberlain, a resident of my riding, received the long-awaited call a healthy lung transplant lung was finally available. He rushed to Vancouver General Hospital from the island late on a Friday night in February, only 2 weeks ago, only to have his surgery cancelled at the last minute due to a lack of a perfusionist. Another casualty of BC's chronic healthcare staffing crisis. How many more British Columbians must suffer, and how many more organs will be thrown in the trash before this government fixes BC's healthcare staffing shortages?
Before the chair recognizes Minister of Health, I want to caution all members not to use any electronic devices during the question period. Thank you. Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question, and welcome to your new role as the critic for seniors care and for rural health. And I know that my colleague from Courtney Comox cares just as much about the services that people need and understands that we have a lot of work to do to strengthen our public health care system. Mr. Speaker, that's exactly what we're focused on. And we know that in this time of a global shortage of healthcare workers,
that serious action needs to be taken, and that's exactly what we're doing. Mr. Speaker, from attracting and retaining more doctors, nurses, and healthcare workers than ever before, by working to break down the barriers to get internationally trained graduates, working here in the province, delivering the care that they were trained to do for people here. Mr. Speaker, by adding 128 seats to the UBC Medical School, distributed across the province, a new medical school coming to Surrey focused specifically on training more family physicians here in this province. Mr. Speaker, there is a lot of work to do, but it is only by this work, concerted month after month, year after year, that we are going to continue to build the healthcare system here. And it is showing progress. We are showing progress. We've attracted more doctors and nurses than ever before, and we're going to continue this work. Thank you.
Member supplemental.
Mr. Speaker, BC had 30 perfusionists in 2002. In a recent survey, 12 have left for the United States. 38%, aged 40 or younger, have signaled their intent to leave the profession in a short few years, and nearly 24% are planning on retiring in the next 5. In yesterday's throne speech, this government committed to attracting talent from the United States. How does this minister plan to stop the brain drain and bring back the specialists we need here in BC to save British Columbians' lives?
Minister of Health.
Thank you, Mr. Speaker. And yes, it is incredibly frustrating for somebody who's going through the experience like the member speaks of. That's why we've got to continue the work to attract and retain more doctors and specialists. That's why we're working with a college to reduce the barriers for people to practice here in BC by removing or making it possible for physicians from other parts of Canada to be certified immediately, by working with the college to ensure that within 6 weeks, those specialists and physicians coming from jurisdictions, comparable jurisdictions around the world, are able to practice here in BC. That is work that we are doing right now, Mr. Speaker, and we are going to continue it. Thank you.
Member for Langley Abbotsford.
Mr. Speaker, the Kootenay Bay Balfour Ferry strike has put local lives in absolute turmoil since September. I have heard from countless people of a failing ferry service and the impact on their lives, having to take a treacherous 3-hour trip in the dark through the Kootenay Pass. Yet the member from Kootenay Central sits idly by and allows this to happen without lifting a finger. My question to the Transport Minister: why don't the lives of East Kootenay matter to this government?
Minister of Labour.
Thank you very much, Honourable Speaker, and I thank the member for the question. Of course, I understand that people in the Kootenays do really rely on the ferry system and that they're frustrated with the impacts of this situation. I have urged both parties to be at the bargaining table, to work hard, diligently, and with urgency to end this dispute. We know that negotiations are right now taking place between the operator and their employees. Government is not at the table in these talks. And we know that the most sustainable and best outcomes in a negotiating process occur at the bargaining table. And again, I'm strongly urging the parties to be at the bargaining table, to work with urgency and diligence in resolving their collective agreement issues so that life can get back to normal for people in the Kootenays. Thank you.
Member, wait. Now you can start.
Mr. Speaker, this strike has cost people their jobs. A business owner lost $2,000 in 1 week because people couldn't simply get to him. 10 sailings have been scaled back to 3. A father who cannot get his autistic son to medical appointments in Nelson is very critical. Early age diagnosis goes a long way. Again, to the minister, are you going to step in and act for the East Kootenay residents, or will you continue and allow this chaos to reign in these communities?
Member, all the question must be asked through the chair, not to the minister. Thank you. Minister of Labor.
Thank you, Speaker. Again, I understand how frustrating this situation is for people who are impacted by this dispute. Again, the parties are currently at the table in negotiations, talking with each other, working through their issues. I think they understand the importance of resolving this situation for people in the Kootenays. The Labour Relations Board has been working with the community and with the parties to support a resolution to this bargaining dispute. And I am again urging all parties to ensure that they are at the table and working diligently to ensure that this dispute is solved with urgency.
The balanced question period.